Hello and welcome. There's an institutional attempt to get the information technology industry and the healthcare and pharmaceutical industry to work together. A memorandum of understanding was signed recently between Nasscom and Nat Health. Well, that's on one side. Let's understand what are the opportunities at a broader level, particularly in the entrepreneur ecosystem. And let me speak to Vishal Bali, CEO of Fortis Healthcare, who's going to try and take us through this journey, one which he's going to embark on very soon. Vishal, thank you very much for speaking with us.
Pleasure.
So tell us, what's the, so we know, I mean, like I said, there's an institutional side of this whole thing, which is all the big hospitals and chains and everyone coming together, the equipment manufacturers, and that surely means good things ahead. What's the other, the demand and the supply of entrepreneurial talent? What are the creative ideas likely to flourish in this space?
So Govind, first of all, I think as a country, while we have come a long way in healthcare, I think our challenges in the subsequent years are going to be even more, fundamentally because number one, our life expectancy in this country is shooting up. So that we are going to be facing a lot more of the elderly population and healthcare for the elderly population.
There are many states which have a aging population similar to Scandinavia.
Absolutely, absolutely. So, our average life expectancy right now is about 65 years. And it's likely to go up to about 75. So we therefore have a challenge on that side. And on the other side, if you look at the data in terms of the non-communicable diseases, so India forever was challenging the communicable diseases platform, and then we were able to combat that very efficiently. And now with this, 100 million diabetics in this country by 2040 is a huge number. And the spiral effect of that and some of the other diseases is going to be even more intense. So I think we have multiple challenges. We have challenges of accessibility because obviously 1.2 billion people, infrastructure is very limited. We have a challenge on the disease segment side, and thirdly, we have huge challenges around affordability because of the fact that we are still spending 60% of our healthcare expenses out of pocket. So I guess from that context, number one, there is a great need to create new platforms of healthcare delivery. Secondly, there is also this entire linkage between technology and healthcare, which is very nascent in our environment. The world has used it a lot more than where we are. And having the IT brains that we have in this country, I think we have not sort of optimized that from the healthcare perspective.
Can you illustrate that quickly with one example?
Yeah, so if you look at the number of solutions that many other countries have implemented, particularly around preventive health, we haven't even started to use some of those solutions in this country. And looking at what we are going to see in the future from the perspective of non-communicable diseases, I think getting into preventive health and using information technology solutions to sort of reach preventive health, both to the urban and to some extent the rural population, is going to be very critical. We have a great telecom growth which is happening in this country. Density of telephony is increasing, and we need to ride some of these healthcare solutions on top of the telecom wave.
So preventive health is what you're focused on.
So and I think another area that I very strongly feel that there is tremendous opportunity is in the out-of-hospital care. And that's again an area that I'm very, very passionate about, having seen healthcare delivery for the last 2.5 decades.
When you say out of hospital, do you mean home?
Home healthcare stratified by specialties. So home healthcare for, say, cardiology patients, home healthcare for orthopedic patients, home healthcare for oncology patients. So I'm very passionate about, and I believe that there is tremendous opportunity in the out-of-hospital care, which is home healthcare, diagnostics, preventive, and all bundled together as a new offering. So these are some of the opportunities which I believe new organizations in this country will be able to create, and there is a chronic need for it right now because infrastructure creation will only get more and more limited because of the cost factor associated with it.
Right. So when one thinks of a country like India, you think of problems in scale. Will solutions also have to come in scale, or will the scale be in the creative offering or the creative approach to solving some of these problems?
Govind, I very strongly believe that sometimes we get into this problem of invention and execution, right? I believe that what we have to do well is the execution bit. There are enough and more inventive solutions out there, and so therefore having and information technology allows you to scale and scale very rapidly, provided your core solution has the depth in it. So I basically believe scale is going to be important, and scale should come through the back end of technology. And as long as you can, and that's the reason why out of hospital care or even home care, because scale can then take you into people's homes. And there, if you have good solutions, good healthcare solutions, then getting into higher scalable
And
solutions.
this the whole home care, and there are a couple of startups already in that space, is a very Indian innovation of sorts.
Right.
I mean, this is not something that one hears of in at least the developed countries, at least as a business model.
It is there. It is there in like in the US and even in Japan. You do find home healthcare solutions, but in most of these solutions are factored around probably home nursing.
Yeah, that's what I meant.
Right.
Yeah.
So one has to go beyond that, and one has to move just beyond providing nursing care or physiotherapy at home, but look at it more from the context of that there are these multiple solutions that are required across the specialties. And if there are these various specialties which are going to become more and more chronic in the future, then how does one work around chronic care through a home environment?
Right. So you've been in the hospital world for a while. I don't want to say business, but in that world. What are the 2 or 3 things that you've kind of assimilated and you take away from it? And what are the things that maybe have left you frustrated, not with a company or, but the larger problem that we face as a country?
I think number one, my key takeaway is that when you keep families and patients at the center of all that you do, that is where most solutions lie. So we tend to many times look at a problem more from a clinical perspective in terms of this is a clinical problem and let's find solutions around it. But when you keep the patient at the center, the problems are both clinical and the service associated with it. So therefore, I think my one key big takeaway is the fact that how do you marry the clinical delivery along with the service delivery, and how do you then create a much more efficient outcome of the healthcare experience.
Okay.
So and secondly, I think from the perspective of infrastructure creation is getting more and more difficult in our country because of the fact that real estate costs are increasing, and it is therefore, so even though one wants to do a lot more, but scalability in terms of infrastructure creation, particularly due to lack of affordability, is a frustrating experience because you're just not able to scale. Even if you have a large network and you want to grow that network very rapidly, you're not able to scale it because of these huge challenges that are there in front of us. So I think, therefore, what one can do in an out-of-hospital environment becomes that much more relevant. And that's the reason why I'm thinking of some of the solutions from that context.
Right, Vishal, thank you very much, and all the best for your next venture.
Thank you very much. Thanks.